All right, so it's quite an honor. This is my type of lecture. I love talking to parents and faculty about their children, about how we can help vision enhance learning. Because without vision, which is our dominant sense, how can we navigate this world, which is so very visual? So I'll talk a little bit, I might go off topic a little bit, but this is the outline I set to do. Vision and development. So from infancy upwards, how does vision develop? How is it learned? And how can we enhance it through rehabilitation? The important visual skills that we need for learning. Visual perceptual processing skills, which some of you might be familiar with if there's crossover with occupational therapy here, but we'll delve into a little bit of that. Importantly here for the parents and teachers, some signs of visual problems or vision-related learning problems. What is a functional vision evaluation? You've probably all been to the optometrist before. 2020, good health of the back of the eye, and we'll see you in a year. So it's a very different type of exam. We'll talk a little bit about how I approach the learning, how I approach the visual skills rehab through vision therapy programs, and then of course for you, how do you find out more to help your students, help your children, your friends, your neighbors. So hopefully we'll get through all of this today, but please, it's a small group, so interrupt me, ask me questions. This is the part I love about the lecturing. So we'll go on through vision and development. The boring stuff first, so let's go through some statistics. You can imagine being in the school environment that 90% of school activities are visual in nature. Vision disorders are the fourth most common disability among children in North America, vision problems. And I would say probably 60 to 70% of these children have had their eyes evaluated in a routine eye exam. That's key. 2 to 5% of neurotypical preschool children have impaired vision and nobody knows about it. And the most common visual problems that we're going to talk about today, but most common, are not associated with visual acuity, the so-called I have 20/20 vision, there's nothing wrong with my eyes. So let's go over a little bit about how vision develops. If you're going to take anything away from today, there's two things, and one of them is vision is learned. So we are not born with a perfect set of visual skills. We're not born knowing the contrast sensitivity or peripheral vision. This is all developed. In fact, we're born with fairly poor central vision and just slightly enhanced peripheral vision. And as they go from 0 to 6 months, it generally increases. And by 6 months to 12 months, depending on the study, they're about 20/20. So there's a lot of learning and developing in those critical periods between 0 and 12 months where you're teaching them with contrast sensitivity and patterns and stripes and movement. You're actually enhancing their visual skills for later in life for tracking and focusing. Children learn visual skills from their interactions with their environment, and these experiences mold their visual perception. So I see a lot of infant, new baby exams, but I also see a lot of exams where the child was adopted and we don't know their history, and maybe perhaps they were in a crib for many months without a lot of rotation, a lot of movement, a lot of contrast, and this has impacted, and I see these children later, 14, 15 years old, this has impacted their whole learning career. So Dr. Gazelle in 1949 was way ahead of his years, one of the founding fathers of behavioral optometry, and he said vision is profoundly integrated with the development of the total action system of the child, including posture. So you can imagine if you have double vision or if you have vertical double vision, you might tilt your head to line things up. Coordination, eye-hand coordination makes sense. How fast is something coming towards me? Motor skills, so gross and fine, and even personality and intelligence. Now you're thinking, how is vision about personality and intelligence? But if you're shy, maybe you don't see so well and you can't read lips so well, or if you are enjoying books and you've read since you were 4 and now you're 29 postdoctoral, you can imagine how early visual tracking skills affected your later outcome in life. Thank you. So I want to start with this quote by John Streff, who's an optometrist who did behavioral optometry in the States his whole career and passed away in 2010, I believe, and he pegged this really well. And it'll make sense by the end. So when vision is working well, it guides and leads in all that we do. When not, it interferes. So not only when it's not working, it's not helping us, it actually makes things worse. So we'll go through why that is and how to find the signs of visual problems. So to perceive, a child first must be able to discern differences. That's all perception is, right? A white wall, you can't perceive anything other than the white wall, but once you get contrast or movement on there, then you can perceive a difference, and that's perception. Fixation on an object is the first discrimination task that an infant will do. And it's usually on someone's face, mom or dad's face, contrast from eyes to hairline. You've all seen those studies where they track the eyes and the nose. Motor coordination, this is number 2 of the keys that I wanted you to learn. Motor coordination and vision develop together. So I don't know how familiar this group is with primitive reflexes and survival reflexes when we're born. So we all have a set of instinctual survival involuntary movements when we're born. So if I put an infant down too quickly when he's young, he might have a startle reflex. So arms and legs splay, cross over, and then cry is a 3-step survival reflex. There's also one called the ATNR, which is the asymmetric tonic neck reflex, and you might have seen babies in the fencing pose. So they're flexed on one side and they're extended on the other, and when they're extended, their head moves to link their eyes to their hand. That is the first, you'll see them go back and forth, and I searched my phone today for 20, 30 minutes. I had a picture of my little guy when he was young doing it, and I couldn't find it. I was going to bring it in. But anyway, so I would move a toy, and he would move his eyes, and he'd do that fencing pose to touch, and fencing pose on the other side to touch. And that's our first involuntary survival mechanism that links eyes to movement and touch. Vision has a motor basis. So studies in utero, when the baby is about 24 weeks gestation, the fetus's eyes are still closed until about 7-8 months in utero. So fetus's eyes will move under fused lids in response to the mother's movement. So it's moving, and you know if you went to a carnival and you were spinning around and around, you stop and then your eyes are still doing this so you feel nauseous. So similar thing, with mom's movement, baby's eyes are moving under fused lids in utero. So there's that connection from your vestibular system, balanced cerebellum, with eyes even before they're using sight. So that's why that 20/20 clue isn't the best way to determine if you have good sight. There's so many other visual skills, and it starts in utero. So random movements accidentally provide the beginnings of voluntary motor control. So the baby's lying on his back or his tummy, and he does some random involuntary jerk movements, hits something with his hand. Then the hand and eyes link together, and then we touch, and then we make a voluntary motor movement. That's the beginning of learning. All voluntary motor movements then stem from this self-awareness. So they're creating a mental map. They're creating, where am I in space? Where is this chair in relation to me? And in their mind, they're building north, south, east, west, up, down, left, right, however it is, but they're creating a world around them so they can identify themselves in space. Mental maps are important for the development of bilateral coordination. So moving the same sides of the body doing the same action, or like crawling, lateralization, different sides of the body doing different things at the same time, which is crawling, with cross patterning, which to me visually is one of the most important development skills. So motor actions give the child feedback to interpret and accurately judge visual space. So we can click that one. What has taken the place of vital developmental development play? Screens are wonderful. I used one all day today. However, when motor and learning is so linked, we learn through movement. We learn when we're going and reaching for something, or we're building blocks and we're making a mental map. What has taken place of that? Cell phones, tablets, TV, computers. I'm preaching to the choir here, but I need to say it because I think in another 20 years, I'm seeing my patients are already more nearsighted than they were 10 years ago, and I think we're going to get early cataracts and have an epidemic of retinal disease if we keep going this way without doing something about it. That's my soapbox. So what is vision? So good vision requires more than just 20/20. We need the ability to gather and interpret visual information. So what does that mean? Has anyone seen this before? Perfect. Okay, I'm going to give you a second. I'll go back. Get there. I'm going to give you a second to tell me what that is. They said it. Does everyone see it? That it's a cow. Did it take you a few seconds, or was it? Oh, there's a cow. Okay, good. I was waiting for one of those. Oh, there it is. So when she said, oh, there it is, if you've seen it before, then you'll never unsee it. But she said, oh, there it is. That is when vision happened. So before, I'm assuming you had 20/20-ish vision and contrast sensitivity, and you have good peripheral awareness, and you didn't see it. But then all of a sudden you had your form perception, and you said, okay, those are the ears, that's the nose, there's an eye, and you're sort of looking head on for those who can't see it. That's when vision happened and vision perception happened. Does anyone need help in me delineating this? So she just had vision right there. So his head is there, ears, show it to you guys later. So all those aha moment is when you interpreted your good sight and your good peripheral vision, your good contrastability, and you made meaning to it. And that's when vision occurs. Okay, thank you. So vision is the ability to make a meaningful interpretation of what is seen. Vision is not 20/20. You had good vision before, I'm assuming. So visual acuity testing is the ability to see 20/20 at distance. A certain size letter at 20 feet away means you have 20/20 vision. But even if a child passes this test, it doesn't mean they necessarily don't need glasses or that they're good for a year for their eye check. There's so many other visual skills that really need to be assessed. So the first thing we need to do is gather in important visual skills. Fixation is the first one that we pick up or learn when we're an infant, and that's the fixation on mom and dad and things that are around 12 inches, 0 to 12 inches from their face. So aiming, their eyes. It starts with a motor basis. I touch something and then I needed to look towards it. Ocular motor skills go from aiming to aiming and moving. Reading, following a hockey puck, how fast is that car coming when I want to cross the street. Focusing is like a camera zoom in, or unfocusing camera zoom out to see far. And vergence is your eye teaming. You've probably heard the word convergence, so converge to read the book, diverge to see far away. These skills determine the speed, accuracy, endurance, and comfort of gathering visual information. So number 2, so all of what I just talked about was how does information get into the eyes? Number 2 is what does the brain do with that information? Now if number 1 is distorted, double, or blurry, then that's going to affect how we're processing. So I can't always say, let's do some perceptual testing on you unless I know how information is getting in. Garbage in, garbage out. So there could be a perfectly beautiful software up here. It's just how the information is getting in that's the problem. So the process by which the brain interprets visual information received by the eye, that's what perception is. When they're insufficient, I like this analogy, but if they're having so much trouble getting information into the eyes, they do not have a lot of reserve left for comprehension, for memorizing, for endurance to get to the end of the sentence, or even paragraph chapter. One of the first visual analysis skills that are important for learning is visual discrimination. That's the ability to find differences and likenesses between words. So the test is simple. Is there any OTs in the room, occupational therapy? No. Okay. The test is simple. We show you 5 pictures. I want you to find the one that's a little bit different. You see them in the newspaper, same type of thing. But it's imperative for reading. So small differences like ran and run, there and then, and all those similar words. If you have poor visual discrimination, you might have great vision, but you might not be able to tell the difference, and then you might see an error, have an error on a test. Visual memory, there's 2 types of visual memory. There's sequential visual memory, which is basis in your temporal lobe. And then there's simultaneous, which is like your photographic memory, which is in the parietal lobe. 2 different streams and 2 very different types of memory. This is key, and I like to test visual memory to my patients because Johnny might have a 95th percentile photographic simultaneous memory, but he might plummet on sequential memory. And how are they teaching him in school? Phonics, or memorize it like this, A, P, P, L, E, instead of apple all at once. So if we can use this strength, of course we can rehabilitate, there's neuroplasticity here, we can rehabilitate the area that's a deficit, but let's use his amazing skill of photographic memory and teach him to read like that instead of maybe the usual phonics type program. Spatial relations is determining what is different among several objects that are the same. So this is important for processing in math and processing reading comprehension, even little things like location of one's seat in the classroom. You know, where am I spatially with relation to something else? Form constancy, this is a big one I see in the children with difficulties with reversals, lefts and rights, north, south, east, west, forget about it. And there's a switch that occurs from when we're 4 to 7 onward. Because when we're little, we say, well, this is a water bottle, this is a water bottle, this is a water bottle, and this is a water bottle. This form is constant no matter how you look at it. Then all of a sudden, they're reading English, and we say, this is a B, this is a D, this is a P, and this is a Q. So they have to have a really great mental space, mental map from early on to know that the form, while it was constant, has a completely different language meaning, which to them is a big leap and areas we need to really work with. So these are the children you see number and letter reversals. Sometimes they write was instead of saw, B's and D's, that type of thing. And of course for reading, huge skills for speed of reading is visual closure and figure ground. Figure ground is like your Where's Waldo. So can I find the important detail when I'm scanning a paragraph before a biology test? Or closure, really good readers don't look at every letter in the word and then move on. We get the gestalt of the word, we fill it in our minds, and we go forward. So really great fast speed readers have great visual closure. We don't need to see the whole word to know what it is and move forward. Visual motor integration, the ability to integrate visual information via forms and copying. So eye-hand coordination, but more handwriting, and right now it's keyboarding. And finally, laterality and directionality. We chatted about it with form constancy as well, but this is correct orientation of letters, knowing how to move through space, tie your left shoe, go down the hallway, turn right, that type of mental map, not knowing where they are in space. So what are the signs you might see of one of your students or your children of a vision problem related to processing? So this is a key one. Vision is not useful for this little girl, so she says, forget this, I have to protect myself, arms out and eyes closed. This is telling you vision is not useful. And the most important time when vision needs to be useful is when there's a flying projectile towards you. So, and during my exam, I usually do toss a little bean bag or something to the kids to see what they do. Oftentimes I get this, boof, that. So they know it's coming because I say, I'm going to throw a beanbag at you, but there is no visual, you know, when mom and dad say, follow the ball, for good reason. You can see how fast it's coming, and you link your eye-hand coordination. This is a very simple test where you know their eye-hand coordinations isn't linked, and vision, from that quote in the beginning, wasn't useful. In fact, it's interfering, so we're just going to forget about it. Other things you can see in the classroom are compensation or avoidance. So there's many different types of personalities, but if we can just say there's a type A and a type B. Type A would be the person that it will persevere, probably become nearsighted, get headaches, get eye strain, because it's tough for them and they do not want to disappoint. So they struggle, they get the work done, they take 3 hours longer than the rest of their peers to get their homework done, but they get it done. Then there's also the kids that say, forget this, I'm going to get a headache, the words are blurry, the words are double, look, there's a bird, look, something out the window, look, I'm going to pass a note to my friend. So it just depends. The personality is related to vision, we know this now. It depends on maybe internal pressures, external pressures, what they're going to show, but it could be the exact same visual problem. So these are snippets of patients. Falling asleep while reading, that's telling you visual endurance in your focusing system, among other things. Closing an eye is huge. It's telling me their eyes aren't a team. They're probably seeing double, so let's get rid of one of the offending eyes. Head tilt. Now, a head tilt tells me a lot of things. If we have difficulty with, we talk about vergence, convergence, and divergence, but there's also vertical vergence. And if we have difficulty fusing our eyes this way, then the brain, if I have one eye that's higher than the other, we might tilt our head to line things up. So abnormal postures is often a sign of visual problems, and they are trying to compensate the best way they know. And of course, furrowed brow, frustrated, headachy, that can very much be related to vision problems. Near focusing, so when you're young, we have fantastic focusing ability. Can camera zoom in? To give you a number, 15 to 20 dioptric power of the lens when you're between 0 and 15 years old. So you have very strong focusing power, should have very strong focusing power. When we become 50, 55, we lose our focusing power and we start to do this. But when we're young, we should be able to go right up to the nose. If they can't, you might see rubbing eyes, you might see blinking, you might see red eyes, you might see avoidance. A lot of it is, oh, this is hard to focus on avoidance. Eye strain, poor flexibility, the list can go on. There you go. There's my 55-year-old, 8-year-old. Or the one that's going to bang through it and just squint through it. This is a nice one I like to present to faculty. It shows you how it is to have difficulty tracking. So if you can go ahead and just start reading this for me. I just want to hear your fluency. It starts with, do you remember? There might be some reversals in there. Yeah. I hope they can hear this on the video because it's very fluid and it's beautiful. Someone's really good. Yeah. Good. I'll pretend it's done because I have no idea where you guys are. So can you imagine that you just finished that, you feel very proud of yourself or frustrated with yourself, and then mom says, great, what was that about? You're like, I just made it through it, I'm so proud of myself, I don't know. So that's where the energy reserves go, right? You just spent all that time trying to decipher that in a different language, basically, and then there's a test on it. It's like, give us a break, right? That's how these children feel. So you can take it.
Sorry, we're laughing.
That's okay. So that was a great demonstration, but to write it down, signs of poor tracking or ocular motor dysfunction, omissions while reading, using your finger while you're reading, skipping letters, skipping lines, rereading lines, poor attention, then poor comprehension, all the things that we just showed here could be a sign of poor eye tracking. And some signs and symptoms, and if you want any of my signs and symptom slides, just let Debbie know, or I can give you my email at the end of the presentation. But perceptual difficulty. So let's say the information came in beautifully. They can focus, they can track, they can converge their eyes. They're still having difficulty. Their reading comprehension is still low. They still can't remember the word umbrella when you show it then to them 2 sentences later. There could be trouble with visual processing. So those are failure, like I said, failure to recognize the same word in the next sentence, slow copying. So the slow copiers, that could be tracking, but it could be memory. I might look at a sentence up there, the boy walked to town, and then write the boy walked into town. Now, someone else might go T, T, H, H, because they can't remember the whole sentence. So copying can be one or two things. Poor handwriting, misaligning objects, that's tracking, it's also perception. Spatial relations, where are things in relation to others. Symptoms that you might see, smart in everything but school, low self-esteem, temper, aggressive, short attention span, frustration, irritability. Frustration, imagine just reading that paragraph like you just did and then thinking you did so well and they asked you what it's about. The key here, and I tell parents all the time when I'm in the exam room with them, is that they don't know any different. Johnny's not going to come home one day and say, I saw double the whole time I was reading at school. They have no idea, unless it's a new symptom, a concussion or something. They have no idea. They've seen like that their whole life. So this is fairly easy to read. Double vision makes it difficult to read and comprehend, because that's the font size is so big. So I get students coming all the way up to grade 3 with the history of great eye exams. And then grade 3-4 tends to be the big one where I see the patients, because all of a sudden we go from learning to read to reading to learn, font size dramatically decreases, and these symptoms come out. Because tracking a big, magnified, C-spot run is much easier than a paragraph of Chaucer. So double vision makes it difficult to read. If I made this very small, that would make it much more difficult. And we're interpreting it too. So let's go into the exam. So developmental visual evaluation. I definitely recommend routine eye exams. We have to start somewhere. We have to make sure the structure is functional. The structure is functional. It leads to good function. So eye health, visual acuity, refraction means, do you need glasses? Are you nearsighted? Do you have astigmatism? Are you farsighted? Visual skills and visual information processing needs to be addressed if we're concerned about vision and learning, and there seems to be a missing puzzle piece here. Can they focus? Can they team their eyes together? And can they track when they're reading? After that, if all looks good, or even if it doesn't, I might want to also know visual processing. Motor skills, visual analysis skills, the ones that we discussed, and lefts, rights, laterality, directionality. So when I talk to parents, I put a pyramid up. So we need a strong foundation. So we need good ocular health. All the refractive surfaces need to be clear. The cornea, the lens, for the image to get to the retina. The health needs to be strong. The next up from that, if we have a beautiful eye, and we usually do, is, do you need glasses? Do you have a paresis or palsy? Can you get your eyes in all motor fields of gaze? Next up on the pyramid, so we have a strong foundation. Now that we know the eyes are beautiful and we don't need glasses necessarily for seeing, binocularity and accommodation. Can they converge? Can they diverge? Can they focus in and can they focus out? And can they do it for sustained periods of time? It's not, can you do this? Oh, your convergence is fine. We need to test endurance and stamina, especially in this world where everybody is tablet and cell phone. Ocular motor control. So there's a feedback loop. If I bring a book towards somebody, the eyes naturally converge, the lens naturally focuses to a beautiful point. Then we have to sustain those skills and move them to track. So the next level up of your functional skills is eye tracking, which starts with alignment and then left to right tracking. And then finally, the crux of it all, where we're going to do our deep learning, is visual information processing. But you can't start here without a healthy foundation. So this is the importance of the layering. So what are optometrists' role? So we can diagnose, manage, and treat binocular vision problems as we're talking today. But without appropriate treatment, we are ignoring about 25% of our pediatric population. And I'm saying pediatric because this is the group I'm talking to, but this affects us lifelong. But we can also have a concussion, and we can bring us right back to where we were when we were 4 or 5 with our visual skills. So it's the same type of treatment, whether I call it rehabilitation or therapy. It's about teaching those visual skills. I won't bore you with the actual diagnosis, but there is a bunch of them. So there's lots of different treatment options. Corrective lenses are what you're thinking of your typical glasses. So I have astigmatism, I have nearsightedness, farsightedness, I need bifocals, that's typical glasses. Therapeutic glasses are reading lenses. So while I said earlier children have really good focusing ability, if that is not enough, they don't have enough, the 20 diopters I alluded to before, I can give them a +1 or 0.5 just to kick-start that system and do some of the work for their eyes. That other work can go to allotting energy for comprehension. And we also have prism lenses or performance lenses that can change space. So I often prescribe prism lenses. Prisms can go in different directions. It's just picture a prism. I can shift space up, down, left, or right. But when if I take a prism and I put it base down, I shift space up. Naturally, when we go from down to up, not only does your posture change, but your eye posture changes and it opens up your side vision. So I have these very focal kids who are word to word, reading through straws. And if I can just enhance their peripheral vision with some prisms, tell them where to go next with their visual system, we can enhance the tracking that way. My favorite treatment option is through Neuroplasticity, a visual motor rehab program. So it's case specific, it's tailored to the patient depending on their problems, and it helps them develop or improve the visual skills that we diagnosed earlier. I wish it was memorized, but it's not. It improves visual comfort, ease, and efficiency. So how well and how long can they study for, how well can they study for, and changes how a patient processes or interprets visual information. So the kid I alluded to earlier with the 95th percentile sequential memory and poor simultaneous memory, well, that's great. We know his strengths, so we can help him now, but let's get both up to par and we'll get him flying. So how does VT work? I'm preaching to the choir here because I have neuroplasticity family here, and this is exactly what we're doing. And in fact, at Aerosmith, when I toured the school, I thought, man, they're doing vision therapy and they don't know it. It's fantastic. Neuroplasticity provides us with a brain that can adapt not only to changes inflicted by damage, but allows adaptation to any and all experiences and changes we may encounter. So there's old theories that the brain was static and didn't change past a critical age. We know now, neuroplasticity, I can say, is scientific proof that we can change synapses, strengthen neurons, strengthen connections, and change the way we think. So researchers show that the brain changes its very structure when they do fMRIs. With each different activity it performs, perfecting its circuits so it is better suited to the task at hand. I can learn a new language as an adult. I could learn how to play tennis as an adult. I probably wouldn't be where someone who started when they were 4, but we can learn new skills. And we always used to say the old adage, practice makes perfect. I sort of believe that. But we have a lot of children practicing every day and not making perfect. So what we need to change that saying is perfect practice makes perfect. We are running the wheels trying to say use your finger, use a line guide, put a highlighter when you're tracking. We're not accessing those areas of the brain that are actually enhancing tracking, we're just compensating for it. So perfect practice makes perfect. So vision therapy involves the principles of perceptual and motor learning with its basis being neuroplasticity. It incorporates concepts of neural reprogramming and long-term potentiation, which is after I've studied and I go to sleep, all of that storage, if we have a good sleep and we didn't pull an all-nighter, goes to our LTP, or long-term potentiation, and that's how we remember it and that's how we learn it. We also learn via feedback, repetition, reinforcement, and self-awareness. So a vision therapy program It's a lot of repetition, it's feedback, but it's motivation. I can teach anyone the skills they need for vision therapy if they're motivated. We know when we're at a level of frustration and you're still trying to teach, there's going to be no long-term potentiation that night. So there's a fine line of keeping things fun and engaging than running the mill and no longer motor learning. So a neural network notion of stimulating stronger synaptic connectivity by appropriate activation and repetition. So we're accessing the areas of the brain that we need while keeping it at a motivated neural learning area. Has anyone heard of vision therapy before? Fantastic. Okay, wonderful. We've been doing it as developmental optometrists since, well, I trained in the States, it's much more common there, since the 1940s, 1950s. Less so up in Canada, but of course we need evidence-based medicine to practice. And the most recent one, it's a continuation, started in 2008, there's actually some subsects now in 2013 that were published. Finally, the National Institute of Health funded the study to determine the best treatment for children with visual skills problems, mainly convergence insufficiency. And the results, not shocked, indicated that active VT is the treatment of choice as it is the most effective treatment. Now, the other options were placebo glasses in the study or reading glasses. So neither of those are teaching them anything about how to track, how to read, how to converge the eyes. Yes, so what is vision therapy? So at my office, and I speak for myself, but it's generally the same across the board. There are weekly sessions. We give home support. I've learned not to say homework, home support activities, and we monitor the progress each week. So we say, Johnny, we're going to have our 45-minute session. We're going to work on XYZ skills. This is your home support activities. Bring it back in. We'll see where you're at in a week, and then we program from there. If they're at the same level, we might bring it down a notch, increase motivation, and go from there. But if they fly through, we fly with them. For the ocular motor skills, which is your tracking skills, our goals are, I have number goals. So mom, dad, I want to see them at 20 prism diopters of convergence by this end. But we, of course, have patient goals and parent goals, and they all need to really align. So mom might say, I want him to be reading a chapter book by the end of the summer. Johnny might say, I want to be number one on my baseball team by the end of the summer. Now, luckily, those skills are actually very similar, tracking. Following the ball, following the players, reading, but we have to be keep the children motivated as well. So the oculomotor skills, our goals are improved accuracy and speed in your pursuit and your saccades, which are your two types of eye movements. Reduced number of refixations and regressions. So that's when we put the children on a computer. We have an eye gaze tracker. This is during the initial assessment. And we have him following small target left to right, jumpy targets like reading, circular targets. And then after that 5 minutes, I say, okay, Johnny, I'm going to show mom and dad how your eyes were moving when we were doing the task. And is it a beautiful straight line? Do they have regression? So do they skip? Do they jump around? It's very, pun intended, eye-opening for the parents because they can really see how the children were reading and tracking. And then at the end of the therapy program, we'll put them back on that machine or throughout, and we'll make sure we can gain some progress. For vergent eye movements, we want to improve their depth perception and their speed of it. So can they converge? Can they maintain their eyes as a team? And can they track while they're doing it? And accommodation or eye focusing is increasing their mostly amplitude. So can they endure an hour of reading, an hour of homework? Can they endure focusing near to far, copying from a board for a university lecture that's 3 hours? Those types of performance skills. For you, this is a great slide to ask your optometrist. A lot of them now in Canada know about vision therapy, refer or do it themselves. Ask, do you provide work or school-related visual perception tests? Do you provide a full series of near-point vision tests and perceptual tests? Do you provide full vision care and vision therapy in your office, or can you refer me to someone who does? This isn't everybody's niche. My husband's an optometrist and he's retinal disease and glaucoma. There's different avenues, but can you refer me to someone who is best treat my child or my loved one? And will you see the patient again at regular interviews to determine the progress? That is key to any programming, therapy program. It's not here, converge your eyes 10 times for the next 10 weeks. You're fine. Is there an actual tailored protocol, a program we're following, and will you follow through to make sure I'm seeing progress? So who can benefit from a vision therapy program? So the cases we talked about, visual perception cases, learning related cases. Binocular vision is eye teaming, so poor eye teaming. concussion, we see a lot of concussion patients, mild traumatic brain injury, acquired brain injury, those are your stroke, your encephalitis patients. Stroke patients are a different animal in that oftentimes they have a cut in half their visual field, left or right, and so we teach them compensating techniques to rehabilitate, so maybe they can get their driver's license again, or maybe they stop bumping into things on the right or left side. And I have a lot of athletes. 2 of my athletes have gone pro, which is so excited for our team. I'm proud of my therapists. But this is huge in the sports world right now. They have great sometimes they have great visual skills. Can we enhance that? Of course we can. That's all what sports is about. So we take those basic visual skills and we add movement, we add speed, we add reaction time and peripheral awareness, and we get these athletes to the top of their game. So let's review the 2 main things. I hope I made my point. But vision is learned. And we can learn, we know through neuroplasticity at any time in our life. I want to learn a new language right now. So it is learned and it's never too late. And it's going to develop depending on our experiences. Vision leads your motor system. Your clumsy kids, your kids avoiding sports, your kids who just seem to have 2 left feet, think vision. Important visual skills, tracking, teaming, focusing, and of course the ultimate top of the pyramid is your perception. So yes, clearly it's one of the areas to consider if your child is struggling in school, but you need a team of professionals. So I have a great team that I refer to. We have Norman Doige, we have Wendy, occupational therapist, we have here at Aerosmith for other motor learning, osteopathy, auditory processing. I feel like we're very rich in this area in Toronto. We have great professionals that we work together with. To find out more, so the top one there is my nonprofit, the Canadian Optometrist in VT and Rehab. That's visiontherapycanada.com. So if you're thinking, I live in Leslieville, is there an optometrist that does VT out there? Then you can go to visiontherapycanada.com and find somebody. Every one of those docs on that list have been certified by my board that performs certified vision therapy, because you can be an optometrist without the certification as well. We've vouched for all of the optometrists on at least our Canadian site. And the American site is FCOVD, the College of Optometrists and Vision Development, another great one. They have some Canadians listed there as well, but it's an American site. And the OEP, another American site, Optometric Extension Program. All of these are vouched for fantastic optometrists you can find in your area, or if you have loved ones in the States, and even across the world. So I'll end here with Dr. Streff's quote again. Hopefully it makes a little more sense. When vision is working well, it guides and leads in all that we do, and when not, it interferes. So hopefully, ask me some questions. Hopefully I've helped you out a little bit tonight. Some light bulbs for your kids and your children, and I'll stick around for some questions. Thank you.